students, today we are going to discuss the concept of death and dying. We all know that the human lifespan starts with the neonate stage and ends with the old age. At every stage we deal with different fears, different crises and different developmental tasks. But when it comes to the old age, the most important fear is how to understand the concept of death and the concept of dying, whether it is related to oneself or with the near and dear ones. In this module, we will try to understand how different perceptions lead to the understanding of the concept of death and dying of oneself and also the others. How a person with a mental illness tries to perceive their own fear of death or understand the fear of death and how they facilitate the dying process. There is a famous quotation by Kleiner who stated that nobody can heal old age because old age is not a disease, old age is a part of being born, it is a part of living. Any dying is part of living too. Hence, we need to understand and facilitate the process of dying. Let us understand the meaning of death. Is there any proper definition of death? The meaning attributed to death is not universal. The reason is perception of the death, understanding of the concept of death is influenced by number of factors. Variability in understanding the life and the death exists with regard to number of concepts like belief in an afterlife, the presence of spirits or angels. Some of us believe angels can be helpful to us or non-helpful to us. The taboos associated with death, the need to bury personal items with the deceased, the need to move the person out of the home immediately after the death, and the extent to which death is viewed as a welcome release from life versus an unwanted end of life. That is, some people may be eagerly waiting to relieve from the life, whereas some people they feel it is impending on them. Variability in the belief of death also exists regarding whether or not families and loved ones reunite after death or the deceased member remains as a presence in the lives of the living, that is either as a positive force or a negative force in the life of the family members. Whether death is a natural or unnatural aspect of life, whether death is happening for a higher purpose or death is a test of one's faith. One's understanding of this concept of death is influenced by so many factors like these. The meaning one assigns to the concept of death depends on number of factors like culture, language, religion, spirituality, ethnicity, past experience with death, family beliefs and practices, education, arts, death related rituals, occupation and so many other factors. Different cultures or groups view death in unique ways. It is important to understand that not all people from a similar or a same culture ascribe to their culture's traditional ways of thinking. That is, individuals, though they are part of a particular culture or group, it is not necessary that they should have the same belief and practices as others of that culture or group. I may think divergently, I may not be accepting what my culture says. Responses to the death or the dying process may also be influenced by the age of the person who is dying or who has died. Similarly, the survivor's history and experience with death, the circumstances of the death, that is whether it is protracted, sudden, painful, expected, deliberate or in any other situation. The earlier relationships between the deceased and the survivor also influences in understanding the meaning of the death or the dying process. In certain cases, the degree of guilt associated with the death or the impending death also might be enhancing our understanding of the concept of death and dying. For those who are dying, that is the patients or who are about to die, the variability or the difference in understanding the concept of death will exist with regard to their fears or positive expectations, their sense of comfort, sense of acceptance, that is that there is no other go but have to accept the death that is coming forward, or view of what is to come, degree to which they cherish or dissatisfied from their current lives, their perception of the dying process and their desire to have more or less control over that process. Some people may believe and also practice passive acceptance of death. On the other hand, some people may welcome death, especially when they are undergoing severe pain with regard to their physical health or serious turmoil that is happening in their life. They may feel death is the solution to that and they eagerly wait for it. Some may accept death as a natural part of the life. Some may fight or be frightened of death. Some may perceive that there is life after death. I am just leaving the body but not the soul. Some may believe that death is the end of their being. Some may be confused about the prospect of death. Similarly, the understanding of the concept of death will also be varying, as some people believe that their lifelong beliefs of death have changed as death draws near. That is, like some kind of an enlightenment may take place as the death is approaching. Some may see that death enhances the meaning of the life, gives the significance to their life and also provides the direction to their life and helps them to live fully to the present. Some may wish to die facing the east. So, these are some of the sentiments that people do possess, that they want to die in a particular room, in a particular direction. Some may wish to have ceremonies before their death. Sometimes we read in the newspapers that some people have already planned and discussed with their family as to how their rituals have to be proceeded, where they have to be conducted in the ceremonial or the ritual aspects. Some may wish to die alone. Some may want their loved ones near when they are dying. Some may wish to die at home, and some may prefer to die outside the home, under the trees and sky, nearer to the nature. And some may prefer to die in any healthcare facility or a palliative or hospice care program. So, these are different perceptions related to how they wanted to think of their own death or perceive their own death or try to proceed in a particular way of understanding their death. People's responses to death may also be influenced by their typical responses to loss or crisis. Some may have a pattern of stoicism. Some may feel great relief in being able to discuss their feelings. Some may find comfort in being with others. Some may feel more comfortable being alone. Some people may use their spirituality or religious beliefs for the support. In certain cases, people may wish not to be asked about their loss or impending loss. Another important aspect is there is wide diversity in response to death or conditions that are associated with impending death. For example, if you take cancer patients, if they are under the psychological treatment, counselors might see two extreme conditions of these cancer patients. On one hand, people may be fatalistic and accept the diagnosis without looking for information or confronting the condition. They start feeling hopeless, helpless and pessimistic about surviving. As a result, they feel they are unable to cope or involve with the treatment protocols. That is, they may just give up that this is my destiny. I know that I cannot respond or my body never responds to the treatment. As a result, what happens is they may focus on the past and be future truncated. That is, they avoid dealing with the future or avoid learning more about their condition. That is, completely they feel helplessness and hopelessness and never want to think the other side of the coin. They just give up their situation. But on the other hand, psychological counselors may also see the patients who may develop a fighting spirit and enhance their resilience. As a result, we see them engaging in obtaining information about the condition. They look for various treatments, start remaining optimistic about the outcome of their condition. That is, they do not give up easily, but ready to fight their situation. Such patients are likely to be actively involved in their treatment regimens and make future plans to minimize the effect of cancer on their lifestyles. That is, they have a strong belief that they would overcome the disease and then how they can maintain their lifestyle so that there will not be any relapse to the disease. So, as psychologists or as physicians or as family members, we need to be very sensitive to all these perspectives, and then whenever a treatment program is given to the patient for the survival, we should make the client, that is the patient, understand the benefits of that treatment. That kind of a support and information regarding the treatment will give an optimistic approach to the patient that they could cope with the chronic diseases. Because there are so many perspectives on death and dying, and different cultures, different groups vary in understanding these beliefs and also in practicing the rituals, whenever the aged people who are nearing to the death or who are suffering with the serious chronic illness, when they are provided the counseling, the counselors should avoid imposing their own values or feelings about death. Do not make assumptions about clients' perspectives, faiths, fears or enthusiasm, or criticizing the rituals or the general experience of death. As psychological counselors, they need to understand and respect each person's wishes and do what is necessary to facilitate his wish. Now, the next important concept is, we all are human beings and we try to have some kind of a freedom within our own limits. And even with regard to the concept of dying, human beings prefer to have their own choice, autonomy and dignity in death. So, the research indicated many people approach death with a fear of dependency, and sometimes many fear loss of control, autonomy and dignity in the death. People wish to participate in making decisions, and that empowers the person because they feel they have the opportunity to gain control of many aspects of the end of the life. That is, if a person is suffering with the illness, whatever treatment has to be given to them, generally the doctors and the family members discuss. But if the patient or the dying person is also encouraged to participate in the discussion wherever it is possible, they feel that they still have the control over the situation, that they feel that they have some kind of a dignity, whether they are ending their life or whether they are overcoming the chronic illnesses. This active participation in the decision making process of the treatment regimens can be approached in an individualized, creative and adaptive ways. If given the opportunity, old aged people draw upon their lifelong traits of assertiveness, love of life, creativity, resilience, adjustment and acceptance of the end of life. But are we really allowing or giving that kind of an opportunity to the dying person? Never. Across the globe, generally are not involved in taking the decisions regarding the patient. During the late 1980s and 1990s, a variety of professions and including some of the governments, especially the Western governments, focused on the concept of empowerment in death. We generally speak empowerment throughout the life, but not in the old age, but empowering oneself in taking decisions with regard to their own way of approaching the death is also essential. For many people, death with dignity meant having the choice of when to die, dying without extreme pain, controlling their bodies and making independent decisions. That is, some people and their families wish to avoid a lengthy and difficult dying process. In such cases, doctors suggested that PAS, that is physician assisted suicide, can be appropriate when individuals cannot cope with the chronic diseases. PAS involves conscious decision of the individuals who have a terminal illness to end their lives through euthanasia, that is giving a lethal dose of medication rather than dying over a protracted amount of time. Those who support PAS believe that individuals should have the right to make a decision to end their lives via euthanasia in order to relieve suffering and fears associated with protracted death. These movements in the late 80s and 90s regarding empowerment of dying people prompted the medical community to establish practices and also guidelines for the terminally ill. For example, in 1997, the American Medical Association published quality of care guidelines for those people who are almost at the end of their lives. When we speak about autonomy and death, there are many options for patients today, those who are dying, that their wishes about how they have to end their lives should be respected, that is allowing them to die with dignity. Adults are now able to write advanced directives, that is called ADs, which will allow them to make a decision prior to illness about accepting or refusing treatment at the end of their life. Like how we write a will regarding the legal issues about the dissemination of the property to the family members. Similarly, if a patient or if a person in their old age, if they are impended with any kind of a physical illness, what is that they are expecting, what sort of a treatment they can be given, or in the serious conditions whether they have to be allowed for any treatment or leave them at home to have a peaceful dying. So, all these wishes of an individual can be written in the advanced directives. Of course, in India still this concept is not popular, but in the Western cultures the concept of advanced directives is very encouraging. And these advanced directives are legally binding. ADs are legally binding and must be included in medical records to be certain that the patient's wishes are documented. And ADs can also include a durable power of attorney for health care and a living will. How we have a legal will? Similarly, this is a living will as to how they have to be left alone either with the treatment or without the treatment in certain conditions to have a peaceful death. When we say it is a power of autonomy for health care, it is a document signed in advance and that identifies a relative, physician, friend, lawyer who can be given this power to make the healthcare choices for an individual when the person is no longer in a position to make such kind of choices. So, once this kind of a document is made, the person has to discuss with the other family members, with the near and dear ones, with the friends, with their own family physicians and the legal person, so that whenever it is necessary, the document will come into the action. Individuals can also request DNR orders, that is, do not resuscitate orders. DNRs are directives to physicians, hospitals or nursing homes not to use resuscitation, that is open chest massage, cardiopulmonary resuscitation, electric shock when a person's heart or breath has stopped. So, this is giving an indication that they are not supposed to operate without the will of the patient. The research has mentioned that it is important that end of life issues be discussed early and openly among the patients, healthcare providers, family and persons listed as decision makers for the client. And if these ADs are given to the family members, primary healthcare physicians, nursing homes, hospices, hospitals, attorneys, and perhaps even to the friends, so that they have a clear picture of the wish of the patient, and when it is necessary they act as per the instructions given in the document. Other choices have to do with day-to-day treatment of the people who are ill. These patients are not terminally ill, but sometimes because of their sufferings they cannot take decisions, especially whether to receive hospice or not. If they choose hospice, whether they wish to receive this service at home or in a special care unit of some particular type. So, these choices can be made by the patient if it is possible to him, or the family members have to make a decision related to the treatment given to the individual. The next important concept in understanding the concept of death and dying is palliative care and hospice. Every individual, that is not only the patient, that is the oldest person, but even the family members, the doctors should have a working knowledge of palliative care and hospice programs. This particular care and hospice is based on the premise that people have the right to die pain free and with dignity, and the families of people who are dying should be given support in this process. What are the goals of palliative care? To ease the pain, relieve the symptoms, enhance the quality of life, and respect the decisions and choices of the client. The most important aspect of palliative care is pain can be managed through medications in all settings, and medical personnel, family members, and those in pain can advocate for expert pain relief. Another focus is on caring, not curing a person with an illness or a condition that is expected to lead to death. When we know that there is no other way, there is no possibility of curing the individual, at least enable the process of dying by providing the care that is needed to the individual, and that care has to be provided by the hospital staff and the family members. Palliative care applies to people in the earlier stages of the disease process and involves services that enhance their comfort. Hospice can be provided in hospitals, long-term care settings, freestanding hospice centers, but sometimes it is also provided in the client's home. So, family members, especially those who are taking care, they are requiring the support and the coaching as to how they have to take care of the elderly who are extremely sick. Generally, hospice care is an interdisciplinary team effort. The team will be composed of personal physician, hospice physician, home health aides, nurses, social workers, trained volunteers, and various therapists if needed. So, all these people will work towards symptom control and pain management. In addition to managing the symptoms and pain, the team also provides spiritual and emotional support to the individual and also the family members who are trying to take care of the patient, drugs, equipment, medical supplies, special services like physiotherapy or short-term inpatient care when caregivers need respite from responsibilities or when the symptoms or pain is too difficult to manage in the home, and bereavement counseling and care for surviving friends and family members. This is the goal of the palliative team care. Apart from palliative care and hospice, there are many complementary therapies for those who are dying. According to the Hospice and Palliative Nurses Association, non-drug symptom management therapies, that is complementary therapies, may also improve quality of life, help the patients relieve discomfort and lessen the suffering. They also help them manage symptoms of the persons who are dying. What are the examples of complementary therapies? All of you are familiar with them. They are acupressure, acupuncture, Reiki, reflexology, massage, pet therapy, music therapy, art therapy and aromatherapy. So, these Therapies are not substitute to the medical treatment, but they work as a complementary to the existing treatment regimens. If any old aged person is counseled or taken care by the hospice team, they can inform individuals and their families of these therapies, help them evaluate the benefits associated with them, identify any such therapy programs that are going on at the local level, or the presence of the specialists in these therapies can facilitate a better relief from the symptoms and a better relief from the dying process. These complementary therapies may also promote a sense of well-being, relaxation, relieve the old aged people suffering with chronic illnesses from tension and stress, promote healing and facilitate a sense of balance between body, mind and spirit. Last but not the least, the concept of death and dying can also be understood from a spiritualistic perspective. How we approach our own death or loss of a loved one through death brings individual face to face with their spiritual and religious beliefs. This process, that is the spiritual perspective, may give people comfort, strengthen their faith or cause them to question their faith. In certain cases, when they start questioning their faith, they may be faced with spiritual distress, that is disrupting our own value and belief system. Sometimes spiritual distress is commonly experienced by individuals who are suffering with terminal illness, but it can be expressed in different ways. Signs of spiritual distress include seeking spiritual help, fear of falling asleep at night or other fears, questioning one's belief system, experiencing anger toward a higher power, questioning the meaning of life, feeling a sense of emptiness, loss of direction, feeling abandoned by the higher power, questioning the meaning of suffering, and sometimes having other physical symptoms too. In those situations, the family members, the physicians, and in case if there are psychologists, they can help them by providing deep listening, referring them to be trained in spiritual counseling, or contacting a spiritual leader whom the patient is interested in seeing. Apart from spiritualistic perspective, people engaging in the prayer is also sometimes gives a strength to deal with the grief and the loss. It is very important in the dying process. The dying person sometimes experience a lot of anxiety and show the symptoms of anxiety like shaking, sweating, fear, sleeplessness, disturbing dreams, rapid heartbeat, inability to relax or paying attention to the things. In those situations, the patients or the old aged people have to be given certain strategies in order to deal with their anxiety, like engaging them in the relaxation practices, limit the visitors, keep the environment as calm as possible, help them to write down or express their feelings and thoughts, and celebrate their past accomplishments. The last important aspect is communicating with the people who are dying is also very important. However, it is not really effective and people hesitate or sometimes feel expressionless when they have to communicate with the people who are dying. So, as a result, they may distance themselves from the person, resulting in isolation for the dying person. Instead, at least a non-verbal communication like giving a touch to them will also make them understand that their family members are being with them. This is how we need to understand the concept of death and dying from different cultural perspectives, from one's spiritual perspective, belief in the prayers, and how or communicating with the dying person also facilitates them a soothing process of accepting the reality.